Hi everyone, welcome back to our channel. Hi everyone, welcome back to your channel. I love pharmacology. In this a very important session, let us see what were the conclusions that were drawn from the next NMC webinar. So the NMC suggests that the students from 2024 they'll be facing the next exams. So there are two steps, next step 1 and the next step 2. Next step 1, you'll be having some national level MCQs that will be common for all the students across the India. So once they finish step 1, so step 1 will be the final year examination, that is the phase 3 part 2 examination, and they need not write the theory papers. So once they are clear with the step 1, they can start their internship, and following 1 year at the end of the internship program, each individual has to take up the next step to examination, that will be the practical examination based on your competencies which you have learned through the past 1 year during your internship. So let us briefly go through the objectives, how they are planned, and what are the subjects included in the next step 1 and step 2. So this say that the NMC, the next step 1 will be a comprehensive computer based examination, and it will be of high quality multiple choice questions, ensuring the objectivity and following national wide delivery and conduction with robust fidelity in a secured manner. So it will be a comprehensive computer based MCQ test, and MCQ item will address the higher domains of your knowledge aligned to the competency expected out of the Indian medical graduate or the graduate practicing modern system of medicine, that is allopathy, especially in the India. So basically step 1 will be have the MCQ based examination. Next, let us understand what are the distribution of items and knowledge level of question that will be asked in the step 1. So it will be of MCQ types. Among the MCQ, you're going to have a problem solving as well as analytical skill type of questions. This will be distributed around 60 to 70%, and 20 to 30% of the MCQs will be of comprehensive type. You need to understand and you need to analyze to bring out the answer. And last 5 to 15% will be of recall type, a simple recall type. So from this, you can understand that the NEET MCQs will have some of the case-based MCQs that you need to analyze, think, interpret, and arrive at the answer. So though it may look difficult, but if you are able to clinically correlate when you go to clinical postings, so it will become very easy to solve such analytical skill type of problems. And competency acquisition, what they are going to ask is, so 60% of the level of knowledge will be from must know topic, and 30% they are going to ask from nice to know topic, and 10% from the may know topic. So majority of the 60% will come from the must know topic. So this is the distribution of items and knowledge level they will going to ask in the step 1 MCQs. So next, coming to the papers and distribution of subjects. So NMC suggests that next step 1 examination will have 6 subject papers with respective weightage in items and time locations. And applied aspect of all subjects of MBBS, including forensic medicine, toxicology, and community medicine, will be mainstreamed into relevant clinical subjects. So what does this paragraph says about? So they are saying applied aspect of all subjects of MBBS. It starts from your phase 1, phase 2, as well as phase 3. So in phase 1 you have anatomy, physiology, and biochemistry. In phase 1 you have anatomy, physiology and biochemistry. In phase 2 you have a pharmacology, pathology and microbiology. And in phase 3 you have got forensic medicine and toxicology, as well as the community medicine. So all the phase 1, phase 2, phase 3 subject related questions will be integrated with the relevant clinical discipline. Like example, for say pathology can be integrated with the medicine, orthopedics, even pediatrics, OBG, etc. Likewise, the pharmacology subjects can be integrated with pediatrics, medicine, even OBG, orthopedics, etc. Based on the conditions, they're going to correlate or integrate the basic subjects with the clinical subjects. And in each paper, 10% of item will pertain to applied aspects of related subjects, applied aspects. So they're going to concentrate on the applied aspects. So basically 10% will be of a basic disciplines, and their clinical aspects or applications will be tested in the related subjects. So this is the following table which provides the subjects in each paper with respective weightage in items and time allocated with provision of items distribution. So there will be 6 papers. Please remember, you will have a medicine and allied subjects. Medicine means medicine and allied subjects like radiology, you can have pulmonary medicine, you can have psychiatry, etc. So medicine and allied subjects will have 120 items, 120 MCQs, and time duration is 3 hours. Surgical and allied subjects. Surgical and allied subjects means you can have orthopedics, you can have other super specialty subjects like plastic surgery, etc. So surgery and allied subjects will constitute about 120 items for 3 hours duration. So obstetrics and gynecology will have again 120 items and 3 hours duration. So pediatrics is the fourth paper which will have 60 items and for 1.5 hour. That is ENT, otorhinolaryngology, for 60 items and it is for 1.5 hours. And ophthalmology will contain 60 items and it is for 1.5 hours. So basically you have 6 papers to written in the final year examination, that is in the phase 3 part 2, just before entering into the internship program. So only if you are able to pass this, you will be allowed to do the internship program. So next, coming to the proposed time schedule of the papers. So below schedule is only indicative of subjects to feasibility and logistic, and this might change once the regulation is released in the gazetted notification. So medicine and allied subjects will have 3 hours duration. There will be 2 hours break followed by pediatrics. So next day will be the rest day. There will be no examination, but surgery and allied subjects will be on the alternative day. You will have a 3 hours and examination, 2 hours break, and otorhinolaryngology 1.5 hours. Again the next day will be the break, and we'll have OBG 3 hours, 120 items, and ophthalmology 1.5 hours. That is, we'll have a 60 questions after a break of 2 hours. So usually they are combining 120 item in the morning session and 60 item in the afternoon session. So entire examination will be for 3 days, and this will be an alternative days. So objective of next 2 is, so next 2 shall be comprehensive practical and clinical examination that will be conducted after completion of the internship. That will going to evaluate your competencies in clinical diagnosis, patient examination, clinical decision making skills, practical and communication skills, which are necessary for practice of modern medicine or the modern system of medicine, especially in India. Basically, once you clear step 1, you'll be allowed to do an internship program. At the end of the internship program, again you need to take a practical clinical examination, and again you will be assessed for the clinical diagnosing skills, patient communication skills, and the clinical decision making skills, etc. Only after this you will be able to practice it, and if you want to do further post graduation, you can go for post graduation based on the next one scores. So what step 2 will going to evaluate? So what are the evaluation methods for steps 2? In step 2, each examination would comprise of actual cases. It can be of objective structured clinical examination, that is OSCE. Even it can be of simulation based learning or simulation based assessment, and depending upon the ability of satisfactory or unsatisfactory performance of an individual, there shall be only two levels of grading: whether the student is competent, that means pass, or not competent, that means fail. Again they need to retake up the evaluation process. So what will be the distribution of subjects? So following subject will be evaluated during next two. Again the same things, the same six major subjects, that is medicine and allied subjects, surgery and allied subjects, OBG, pediatrics, otorhinolaryngology, ophthalmology and orthopedics, with physical medicine and rehabilitation. So this will be for your practical assessment at the end of your internship program. So what will be the time schedule? The time schedule and modalities of next step 2 shall be decided by NMC. They have not still yet decided what has to be done uh, in clear in the step 2 process. And respective authorized university and institutions after completion of internship and prior to admission process for the post graduation course of that year. So before the candidates are admitted into the postgraduate course, they need to undergo the step 2. So without step 2, they will not be allowed to take up the postgraduate course based on their next one scores. So this is the schedule, tentative time schedule of next examination and associated events. The time schedule of entire process of national exit test, examination, internship, admission to broad specialty postgraduate courses shall be announced by the commission and other bodies authorized by the commission. So the next step 1 will be done around May to November, May. So it will be done twice actually, in the May as well as in the during November and December. So date of results first week of June, December. A third MBBS, that is final MBBS part 2, that is phase 3 part 2. A practical and clinical university examination in the first week of June or December, and results again in the third week of June and December. So internship will going to start in the internship January 1st as well as July, and results will be 31st December, 30th June following the year. So after the 1 year. So basically what you will do, first you will take a next step 1. Once you have passed the next step 1, what you will have, again you will have a clinical university examination. So there will be a practical examination once you complete step 1. The only thing which differs from previous year examination pattern is, instead of theory examination you will be doing the next step 1 process, and as it is practical will be there similar to that of the previous years. So once you passed the practical university examination, and the next step 1 you will be allowed for internship program, and next 2 is for regular, that will be during third week of June. If you finish in May, you'll be allowed to, after 1 year you will be allowed to take in June. If you start from November, you'll be allowed to take in the next December. You can take the next step 2 process. So you can take the next 2 supplementary also in the 6 months interval of time, and after that if you pass the next 2 based on the next one score, you will be allowed for postgraduate admission. So postgraduate course will start from 1st July or first week of January. So they have provided a note that there shall again be counseling in the month of December for the seats which remains vacant after earlier counseling held in the May and June session. So conduct of mock test and practice test they have announced. So NMC has announced the conduction of mock test and practice test so that the students will get familiarized with the topics as well as how the pattern of clinical MCQs will be existing in the examination. So it is decided to conduct, they are going to conduct mock test on the 28th July 2023, and registration for the same will start from 28th June 2023. So please remember, this examination will be conducted by All India Institute of Medical Sciences Delhi as a designated authority for next step 1. So only final year student pursuing MBBS courses in the medical college or institution are eligible to take a mock test or practice test. That means the phase 3 and part 2 students are able to take up this test. Aim of such test is familiarize the prospective candidates with the computer based test software interface and process flow in the examination center. The sample questions in the mock practice will only exemplify pattern, and it's a format for next step 1 examination, and still they may not represent the complete next step 1 examination syllabus and coverage. So they have put a disclaimer also, like complete detail of next examination is being notified through regulation separately, and so anything contained or spoken in this presentation will be superseded by such regulation. So they are going to put up the proper regulation in the amendment, and they are going to get it in the gazetted notified. So whatever the things which comes under gazetted notification will be the final thing, and these what are the things we discussed based on NMC's suggestion may change also during when the regulation is notified in the notified after the approval from the committee. So basically this will be a similar pattern to that of USMLE, and the examination will be similar to that of almost the INSET. So INSET will not be there probably from the next year. Probably in the November 2023 you will have a NSET, and from next year onwards, so NSET will be merged with the next step 1 process. So this was regarding the newer NMC guideline for conducting next step 1 and step 2 examinations. So if you have any query or any related doubts, you can put up in the comment box. We'll try to answer your queries. So do not get feared. So it will be a examination similar to that of the NSET exams, and let us see what are the questions or the type of questions that they're going to ask in the mock or the practice test, so that you can prepare based on those questions. You can analyze what will be the type of question that will be asked from the subject disciplines. All the best. Thank you.